Hello, very good morning. Myself Neha Parmar, Assistant Professor, Dinsha Patel College of Nursing from the Department of Obstetric and Gynecological Nursing. Today we are going to see and discuss regarding the normal labor and nursing management of first stage of labor and different types of stages of labor. So, see the some of the terminologies that we will discuss. The first terminology, that is a labor. Labor means that the series of movements that take. Another terminology we will see, that is the first stage of labor. So it starts from the onset of labor pains to the full dilatation of the cervix, that is called a cervical stage also. In the first stage of labor, there are certain phases are there, that is a latent phase, that is also it's a prior to active the first stage of labor. It may last up to 6 to 8 hours into the primary gravida, like 0 to 3 semi of cervical dilatation happen, that is called the latent phase. Then when active phase is there, in that cervix undergoes the rapid dilatation. There is a cervical dilatation happens into the rapid form. It begins when the cervix 3 to 4 semi dilated is complete, when the cervix is fully dilated, right? So in the active phase what happens, the cervix is 3 to 4 semi dilated is completed, right? In the latent phase 3 semi dilatation is been there. In the active phase 3 to 4 semi dilatation is been happened. After that, whatever the dilatation is been happening into the mother in the cervical dilatation, that is called the active phase, when the cervix is fully dilated, right? So that comes into the active phase. Another terminology that we will say, there is a transitional phase. So it is a stage when the cervix is formed around the 8 semi dilated. The cervix is dilated about 8 semi until it is fully dilated, that is a 10 semi of dilatation. So then and then we can get the what to say, expulsion of the fetus, right? Until the expulsive contraction during the stage are felt by the woman, right? That is called the transitional phase. Another definition and another terminology that says the lightening. So it is a we can say another name, that is a welcome sign, where occurs due to the active pulling of lower pole of the uterus, right? So active pulling of the lower pole of the uterus, widening the symphysis pubis. In present part, whether it is a cephalic or a breech presentation, whatever presentation is been there, head is been there, buttocks is been there, right? So presenting part that sinks into the true pelvis few weeks before the onset of labor into the primary gravida mother, that is called the lightening. Another definition that we will see, that is a show, that is the presence of blood stained cervical mucus plug, or we can say the secretion with the onset of labor, right? That is called the show. Another type you can say expulsion of cervical mucus plug mixed with the blood, that is called the show. Effacement of the cervix, in that effacement is a process of thinning out the layer of the skin, that is thinned out. It is measured as a short percentage of shortness of the cervical canal, that is called the effacement of the cervix. These are the parts of the uterus. You can see the fundus and a body and the ovary and the fallopian tube. We can here we can see the fallopian tube, right? These are the fallopian tube. They are also the another parts of the fallopian tubes are there, like ampulla, isthmus, right? Then fimbria and all. Infundibulum is also there. Ovary has been there. We can see the vagina over there. This is the cervix. This is the internal os. This is the external os. The uterus hole we can see, the fundus and the body and the isthmus, right? So this is the parts we can see here. Another thing. In that, amniotomy involves the splitting of the amnion and chorion to release the liquor, right? We have to do the artificial rupture of membrane, where we have to split out the amnion layer and the chorion layer to release the liquor amni, right? Another definition, that is a episiotomy. Episiotomy is a surgical incision we have to made into the perineum to enlarge the space at the outlet, right? Thereby we can facilitate the birth of the baby or a child, right? This is a simple definition we can go through for the labor process. Another definition of the labor, that is a series of events that takes place into the genital organ in an expert effort to expel out the viable products of conception, right? Out of the womb through the vagina into the outer world is called the labor. There are certain series of events that takes place into the genital organs of the mother in effort to expel out the viable products of conception out of the womb in the sense of uterine cavity through the vagina into the outer world, that is called the labor. Another thing we can see, or another definition we will see, that is labor may be defined as a rhythmic contraction and a relaxation. Like contractions happens, then relaxation happens of the uterine muscle with a progressive effacement. As we know, effacement is a thinning out the layer, or cervical dilatation may be happen, and dilatation matlab opening of the cervix leading to expulsion of the products of the conception, right? That is also given by the Clausen et al. In 1973. Another definition we can see, that is labor is described as the process by which the fetus, placenta, membranes are expelled through the birth canal, that is also called the labor. In a simple manner, you can say whatever the conception things are there, baby products are there, that has to be expelled out through the vaginal cavity, that is called the labor. Another definition, that is a normal labor. So normal labor, another name of the normal labor, that is the eutosia. Labor is called normal if it is fulfilling the following criteria, like a spontaneous is onset at term, right? With the presentation, that should be vertex without undue prolongation, that should not be a prolonged labor or a precipitate labor. Natural termination with the minimal aids like a episiotomy that can be happen, right? And without having any complication that affect the health of the mother or a baby, that is called the eutosia. So don't confuse with the labor and a normal labor. Both the definition are completely different. So you have to see on that. Another definition, that is abnormal labor, that is a dystocia. Any deviation from the definition of the normal labor, that is called the abnormal labor. Thus a labor in a case with the presentation other than the vertex or having some complication even with the vertex presentation. What happens into the abnormal labor? Like presentation is there, but other than the vertex presentation, or if the vertex presentation is been there, but there are certain complications are being there, and that is also affecting the course of labor, right? Or modifying the nature of the termination, where we have to go for the CAS or a forceps or a venous delivery, right? So that is also modifying the nature of the termination or adversely affecting the maternal and a fetal prognosis, that is called the abnormal labor. There are 3 P's of the normal labor. Also they are also involves the relationship between the 3 P's. There is the first is the power, right? Another is the passage and the passenger. So what are the powers? Powers are the two powers are there, like first one is the primary powers and another is the secondary power. What are the primary powers? The primary powers are the contraction and the retraction of the uterine muscles, and the secondary powers are the contraction of the abdominal muscles and the diaphragm. Which are the passages? So where the baby is going to be come out, that is the pelvis, uterus, vagina and the pelvic floor. These are the important thing that has to be there to come out, to expel out the baby. Which are the passengers? So passengers are mainly the fetus, right, baby, placenta, membranes, like amnion, right? These are the passengers. Another thing, that is a spurious pain, we can say the false pain. How it may be different from the true labor pain, right? So it is found into the primary gravida, then in a multiparous woman. It is usually appears prior on the onset of true labor pain, right? We can see before the true labor pain, we can find it out the false pain by 1 or 2 weeks in primary gravida or by a few days in a multipara mothers. The woman feels pain and discomfort into the abdomen and they are mistaken for the labor pain. So mother might have feeling that she is having the pain, or she is having some ache into the body, in the abdomen, into the groin area or something like that. So she might be having that in her mind that she is having the labor pain, but it is not a labor pain, it is a false pain, spurious pain. Another false pain has the following features, like It is a dull in a nature. It is usually confined to the lower abdomen and groin area, continuous and unrelated with the hardening of the uterus without any effect on the dilatation of the cervix, and usually relieved by enema and the administration of the sedatives. And such pains are probably due to the stretching of the cervix and the lower uterine segment. So these are the following features of the false pain. Another is the premonitory signs of the labor. So which are the signs of labor may happen or mother can have that she might be in a labor, right? The starts from 2 or 3 weeks before the onset of true labor, like lightning, the hair is sinks into the true pelvis. Frequency of maturation might happen to the mother due to the pressure that comes into the true pelvis. Cervical changes may happen, appearance of the false pains, and vaginal secretion may also increase, and also we can see the show, right? So these are the premonitory signs of the labor. We have to educate the mother regarding the premonitory signs of the labor. If she feels any of the changes, she has to consult to the doctor, right? And membranes may be ruptured. Another thing that we have to see, that is the difference between the true labor and a false labor, right? What do you mean by true labor and the false labor? So painful uterine contractions come at a regular interval that comes into the true labor pain, right? And false labor, irregular intervals are there, that is called the false labor pain. Another is a uterine contraction always present, and in the false labor not always present. Intensity of the pain progress with the advancement of the labor, right? And in that false labor the intensity remains the same. There is no changes at all happen into the false labor pain. Another interval between the pain gradually becomes the short in a true labor pain. Here in the false labor that is remains the same. Presence of bulging forewater in the true labor pain. We can see the bulging of the water. Forewater we can see into the true labor pain. In the false labor pain it is absent. The pain felt in the true labor is on the abdomen, back and a groin area. In the false labor what happens, the pain usually felt into the lower abdomen only. Another is a cervical dilatation and effacement is also present into the true labor pain. Here is the absent. Show is usually present. In the false labor pain it is not present. The pain is not relieved by the sedatives or enema, right? Because it is a contraction pain. Contraction pain due to cervical dilatation it is happening. So in the false labor the pain is relieved by the medication also. So these are the difference between the true and false labor. Here we can see the stages of labor. So labor is also divided into the 4 stages. The first stage of labor, second stage of labor, and the third stage and the fourth stage of labor. So first stage of labor is referred as a dilating stage. It is a period from the first true labor contractions to the complete dilatation of the cervix, that is a 10 semi, right? That is called the first stage of labor. The forces involved are the uterine contraction into the first stage of labor. The labor is divided into the 3 phases. The first one is a latent or early, or we can say the prodromal phase, active phase or accelerator phase, or a transient, or we can say the transitional phase that comes into the first stage of labor. Another is the second stage of labor. Second stage of labor is referred as a delivery or expulsive stage. It is starting from the complete full dilatation of the cervix to the birth of the baby, or we can say the expulsion of the baby. The forces involved are also the same, that is a uterine contraction plus the intra-abdominal pressure. Another stage, that is the third stage of labor, that is also we can say as a placental stage. Here that starts from the delivery of the baby until the delivery of the placenta, right? The forces are involved, that is uterine contraction and the intra-abdominal pressure. Another stage, that is the fourth stage of labor. The fourth stage of labor is referred as a recovery or stabilization stage. The period begins with the delivery of the placenta and ends with the uterus no longer tends to relax, right? The forces involved are uterine contraction, right? So where we have to see the mother's respiration, vital signs, mother's condition, right? These all are the things we have to see into the fourth stage of labor. So this is a recovery or a stabilization stage of the mother and for the baby. So this all are about the stages of labor and introduction of the labor and the definition and terminologies we have seen. In the next lecture we will discuss regarding the events of the labor, physiology of the labor and the nursing management of the first stage of labor. Thank you so much for patient listening.